This is the protocol for picking up the fridge caps on Zirconia fridges. So at this point, the Zirconia bridges are made. As you can see, there are spacers that were used as impression analog, and the fridge is made to fit on those spacers. The first thing we do after trying it on and making sure that they fit is to use the air abrasion to clean the inside of the Zirconia bridges. For bonding to zirconia to take place, one has to use the air abrasion and then some kind of zirconia primer. This is, as you can see, the abutments in the mouth. The temporaries have been removed from the mouth and the gums have completely healed, and these are the abutments as you see. Then these are the fridge caps that are going to be picked up. We're going to place the fridge caps on the abutments, and each abutment that is sitting away from the gum a little bit, we can put a washer also so that the acrylic doesn't flow under the washer. So we place each cap in and we'll secure it with pressure of the finger. Then we apply the primer. Here I'm using powder and liquid acrylic, so it's an acrylic primer. Then I apply inside all of the spaces. We mix powder and liquid. This is a regular powder and liquid cold cure acrylic. We mix it, and before it starts to set, when it's still in the wet sandy stage, I place them inside the spaces, making sure there are no voids. If you have worked with acrylic, you know you don't have too much time, and from the time this gets to dough stage, you really don't have more than a minute or two to seed it. So you need to be aware of the various setting stages of acrylic so that the surface of the mix does not get dry and get sandy. I put some liquid acrylic on them, and I'm timing this acrylic so that the wet sandy stage passes and then the string stage, and around about time it's in dough stage. After I've dried the caps, I place both the upper and lower fridges in, and then have the patient bite into centrifugal occlusion. Now, we have tried these on before, and we know that there is room for the fridge caps in centrifugal occlusion. Once the patient is biting on it, we hold the patient, we support the jaw for about 4 to 5 minutes. And that's the time it takes for the acrylic to set. Now, as we know, the setting reaction of acrylic is exothermic. So you can warn the patient that they may feel a little bit heat on the gum, but that's okay. The surface of it is not that much, so patient usually doesn't complain about too much heat. After the 5 minutes is up and you've made sure that the acrylic is completely set, you can have the patient open up. And at this point, since you place the caps with the finger pressure only, you should be able to just wiggle the fridges out. So we wiggle them out. What we like to see, as you can see in the picture, is all the caps picked up with almost no void around them, and with some excess acrylic around it. Once we took both of them out with the diamond and underwater, we will remove all the excess acrylic and try to make the intaglio surface convex. After the diamond, we can use some porcelain polishing wheels with different abrasiveness to create more convexity on the intaglio surface and remove any excess. And also, this is Care acrylic polisher for the acrylic around the caps. This is how they should look when everything is finished. As you can see, the surfaces are highly polished. Before we put them in, we will double torque each abutment to 20 Newton centimeter. The double torquing is very important so that you don't get screw loosening later. Then the finished products are placed in the mouth, and once we're sure they're fully seated, we just tap them on. As you can see, the first time I couldn't seat the fridge in, so I took it out and noticed where the obstacle was, and I drilled the obstacle part out. We place the fridges in and tap them like two times on each area, and voila, the fridges are in without any problem. After this, we will use the red stripe bullet-shaped diamond to make sure the occlusion is done right. The occlusion has to be finished in group function, and by group function I mean all the teeth should be touching at all times as much as possible. Remember, there is no canine rise for full arch implant restorations. The tendency is to create a canine rise. You put a canine rise and you're inviting fracture of the canine area. It must be a group function. So contact at many places as possible between upper and lower teeth from anterior to posterior.